ngayon.
Opo, clear din po kayo.
Okay, clear na rin. Sige, okay. Okay. So, wala pa. Wala pa ngang 2 groups ito 24 pa lang. Group 1, group 2 na dito na ba?
Present, Doc, yes.
Si
Yes
Maki
po,
ang
Doc.
si Maki pala. Si Maki, hindi ako binigyan ng Zoom, kaya yung group ko na lang inisnab yung text ko ni Maki.
Wala ako, Doc, na na-receive.
Wala ka. Kasi di ako text, kaya wala ka na-receive.
Yes.
Yes. Ligtas.
Hindi ako text kasi meron na rin akong kaya lang yung password yan, nahihirapan ako ng password ni Rins. Hinahanap ko pa doon sa stream. I-text mo nga ulit sa sa Facebook na lang, Messenger Rins next time. Pag nag-SGT tayo, hinahanap ko pa yung yung classroom at yung comment kasi nandoon sa comment linagay mo yung
Isa-send ko na lang po, Doc. Sa
sige,
group chat po. Opo.
Okay. Group 2, group 3 nandito na ba? Nandito pa lang. Wala pa tapos. Sige, okay lang. You can wait. Group 3 wala pa. Group 4. Sino yan? Si President. Si President Sara Duterte. Okay. Hindi pala si Robredo. Group 3. Group 4, nandito na ba? Wala pa rin.
Andito na po ang group 4.
Group 4. Group 5. Wala pa rin. And then, groups. Okay, makalimang grupo man lang. Kahit isang grupo na lang ang kulang. Makapahinga naman. Kasi natapos kami ng aming SGD. 10 plus na rin. 10:35, 10:40. Kaya pause pa rin ang boses ko. Ang dami kasing attorney sa amin Attorney nag-discuss ng legal issues. Sino yung attorney natin? Si Sales at si
Kuya
sino yung
Josh.
attorney natin?
Si Kuya Josh, Doc.
Si Joseph. Mga attorney namin yan. Huwag kayong sasabat-sabat yan.
Flight attendant din kami, Doc.
At least nandito si Jos. Present siya kasi nasa grupo ko siya. Masisita ko siya. Ang hindi ko din nakakasama talaga sa grouping si Villanueva. Nandito. Anong group si Villanueva?
Grabe, sir. Sir, na-andran mo na ako, sir. Last time.
Yeah. Hindi pa kita na-groupings, diba, sa SGD?
Oo na, sir. Ano yata yung sir? Neuro.
Kasi doon ka lang nagpakita sa case synthesis ko. Wala ka pala. Kaya nakalimutan ko.
Okay, sir.
Maka 10 man lang, maka 45 man lang. Sabi ko magpapahinga ako magsalita, salita pa rin ako ng salita. Sino bang gustong kumanta habang naghihintay? Sino bang pwedeng kumanta habang naghihintay para din ako magsalita?
Maki!
Si Maki ba? Ay, talo yan. Si Benjo ba? Nandito si Benjo? Wala pa si Benjo. Okay, so wala pa sila. Hintayin natin. And sabi ko nga, mag-ingat pa rin kayo, stay safe. Merong 4 na IM residents na nagkaroon. Ang alam ko, mga graduate natin yun. Yung iba doon, nag-positive. 36. Mga 11-10. Kapag wala pa rin. Okay. 36. Wala bang intermission dyan? President? Dyan.
Parents would
Intermission naman para mabuhayan tayo. Masyado nang depress ang araw natin. Kasama pa ng sexual abuse. Ay, talaga, na-depressed na lalo. dinoktor-doktor lang yun. Ako, ako, ako ang gumawa ng case eh. Kaya nga nag-synthesis ako. Inano ko lang, parang, kasi nga, inano ko siya, ipasok yung pedya kasi nga, pedya, para maipasok yung pedya lang. Actually, pwedeng adult ito eh. Kaya lang, para lang maano ko, maipasok ko yung pedya, kaya ginawa kong ganun. Okay? Okay. So, isang group na lang bang kulang o tatlo pa rin? Wala akong video, ano? Wala akong video sa inyo. Black lang. Nakailaw naman yung aking webcam. Subukan kong i-record. Okay. Start video natin. Ayaw. Ayaw. Okay, ayaw. Ito lang bakit. Meron naman ito kanina. USB. Ayaw talaga. Okay, so start na ba tayo? Okay, 2 minutes na lang. May quiz tayo, may exam tayo. Graded exam. Sino ang leader ng Group 1? Group 2, Group 3, Group 4, Group 5, Group 6?
Group 2, Maki po.
Sino ang Group 2 leader?
Group 1, Ranyosa po.
Kuya Josh po, Ranyosa.
Uy,
Kayo,
kayo.
nag-coordinate tayo. Ang isa na lang bang group 1 wala? Ba't ayaw gumana ng aking webcam? Ayaw talaga. 42. So, start na. Paano ba? So, paano ito? Mag-share screen ako, no?
Yes po, Doc. Pwede na po kayo mag-share screen.
Share screen. Teka. And then, share screen. Okay. This one. Okay. And then, wait, somebody start. Okay, anong nakikita nyo ngayon? Hello?
Wala po, Doc.
Wala pa po, Doc.
Wala pa. Okay. Wala kayong nakikita yung here. Ito siguro. Wala. Ito wala pa rin.
Wala
Wala pa po.
Ano kakaproblema? I-share screen ko eh. This one. Ito, may nakikita kayo?
Meron na po.
Ang nakikita nyo yung anong nakikita nyo?
Wallpaper po, Doc.
Yung wallpaper, okay?
Yes.
Ngayon, mag-start ako, play from the start. Okay, ngayon, anong nakita nyo na?
Hear the cry po.
Okay, so start na tayo. Okay, start na ba tayo? Okay, labas ko yung laser pointer. Okay, again, good morning everyone. Okay. So this is the case synthesis ng ating first and only male repro case. Kasi by next week, we only have 3 weeks. So next week natin ay female genital yan, female reproductive system. Okay? So, natapos natin yung endorenal. And then, almost finished na tayo ng ating school year. At naging online lang talaga lahat. So, 3 weeks ang repro natin. Then after the repro, anong next ninyo? Case? Anong next module?
Head and
Special sense.
Spatial senses. 3 or 4 weeks atang spatial senses. So, mag-review tayo. So, let us have an exam. Gusto nyo ba magkaroon ng exam? Oral? Okay, joke na lang nga. Parang ano eh. So, we just call na lang siguro yung per group. Okay? Start tayo. Hindi ko alam kung nakita nyo na ito. Go up to a tree and take a lick. Okay, group 1. If you pee attracts ants, you got what? Group 1. If your pee attracts ants, you got group 1.
Sugar in your urine. Leukosuria, Doc.
Okay. You got diabetes.
Diabetes. Yes.
Okay. Group 2. If it dries fast, blank is high. Group 2. Nandiyan na ba yung group 2? Wala pa? Wala pa, President? Group 3.
Doc, wait lang po.
Your sodium, Doc, is high.
Okay. Anong group yung sumagot?
Group 2 po.
Okay. Your sodium is high. If it smells like meat, group 3. Group 3 na ba?
Albumin is high or protein is high?
Ano?
Albumin or protein is high?
Protein is high? Tingnan natin. Tama. Your cholesterol is high. If you forgot to unzip, group, ano na ba? Group 4?
It's Alzheimer's.
Group 4 ba ang sumagot?
Yes po, Doc.
Yes, at least nag-check ako ng attendance. Alzheimer's. If you miss the 3, group 5. If you miss, hindi umabot sa puno. Group 5, nandiyan na ba yung group 5? Oh, wala pa rin. Okay, group 6.
Parkinson's. Parkinson's, Doc.
Parkinson's, if you miss a 3. Parkinson's, ang galing If you peed on your shoes, group 5, balik tayo sa group 5, wala pa rin. So group 5, wala pa. Okay, random na lang tayo para maano tayo. Okay, group 1 na lang siguro, yung group ko. If you peed in your shoes, group 1.
Enlarged prostate.
Group 1, sige. Friends. Group 1.
If you peed on your shoes, enlarged ang prostate, Doc, hindi umabot.
Uy, galing. Enlarged prostate. Okay. If you can't smell it, group 5, nandiyan na ba? Wala pa rin? Okay, sa group 3 na lang. Group 3, sige, group 3. If you can't smell it, anong sagot?
Pwede pong itong sign ng
COVID po, Doc.
COVID-19.
Yes. Okay, warm up lang naman yun, okay? Okay, nakuha ko lang ito sa Facebook Okay, start na tayo. For our identifying data, we have an 8-year-old boy from TV Albay. The percentile reliability, yung mothering format natin with 100% percentile reliability. Ang chief complaint niya ay yellowish urethral discharge. So the chief complaint suggests inflammation of the urethra or urethritis. So very pertinent in a patient with urethritis is, what's very pertinent? Okay, so what is very pertinent in a patient with urethritis is the age of the patient. So GD is only 8-year-old. He is just a child. There's an implication if urethritis is present in adolescent or in adult. Why? Because urethritis in this age group, adolescents and adult, usually the cause is infection, and almost, if not always, is the result of sexual contact. As we know, urethral discharge is the most common presenting complaint of men with STI or sexually transmitted infection. So, among adolescents and adults, in SVI, we ask about sexual activity like unprotected sex or multiple sex partners. And then, okay, unprotected sex, sexual activity niya, ito mga itatanong natin, ano? But in children or in pediatrics, the etiology of urethritis is usually non-infectious. So, we ask about the use of soap, bubble baths, or skin lotions, which can be contained in chemicals that might get inside the penis and causing the irritation of the urethra. So if I ask you in the formative exam, what is the most common etiology of urethritis for pediatrics? Ang sagot ay chemicals. Then, another cause of urethritis among pediatrics ay yung poor hygiene, especially if uncircumcised. Where the smegma, ito yung whitish substance na under the prepuce made up of oil and dead tissues na nag-accumulate doon sa foreskin. Okay? And urethritis can also be seen in medical problems like diabetes mellitus, because in diabetes mellitus, the sugar is high and this can cause thick or parang nagkukos siya ng white discharge around the head of the penis. And then autoimmune diseases like Reiter's syndrome. So what is Reiter's syndrome? Narinig niyo na ba itong Reiter's syndrome? So this is the triad of what? Triad of urethritis, reactive arthritis, and conjunctivitis. Okay. Ang tanong, can we consider infectious urethritis or possibility of sexually transmitted infection in children? Can we consider among pediatrics an STI? Yes. So STI must always be excluded if the STI must always be excluded if the history is suggestive of child sexual abuse by an adult who has the disease. So the questioning in the history would be entirely different. You will not be asking about sexual activity, not about unprotected sex, nor about multiple partners. So when will we suspect urethritis in a child as secondary to child sexual abuse? So kailan tayo kailan natin tayo magsususpect na this is a case of child sexual abuse? Group 3 o Group 5, para ma-check ko lang kung nandiyan na sila. Group 5, are you in? Wala pa rin? Wala pa? President, wala pa siya, no? Group 5, wala pa rin? Wala pa rin na isa sa kanila. Okay, so when shall we suspect urethritis in a child as secondary to child sexual abuse? Okay. So concern about sexual abuse should be raised when a child exhibits emotional signs or non-specific behavioral changes like sleep disorders or nightmares, eating disorders, aggression or aggressiveness or hostile behavior, depression or anxiety, especially if with symptoms of withdrawn behavior, that is spending an unusual amount of time alone. Yung gusto niya lang mapag-isa, so that is already a signs of parang something is wrong with the child. Or fear of an individual or place, usually where the abuse is committed, like bedroom, toilet, or what? Inside the cabinet, pwede din yun. Then, what else? Other than emotional and behavioral changes, you will suspect if there are signs of regression. Okay? Pag sinabi natin regression, they are resuming behaviors that they had grown out, like what? Thumb sucking, enuresis or bedwetting after bladder control has been achieved. Usually, at what age you will achieve bladder control? At what age ba?
5 years old.
5 years old.
What? 3-year-old? Usually, around 2.5, 2-year-old or 2.5-year-old, magkakaroon ka na rin ng most child will have bladder control. Another signs of regression ay yung encopresis. Okay. So, yung soiling after bowel control naman has been achieved. So, kailan naman yung bowel control? Kailan yung bowel control na-achieve ang bowel control? What age?
3 to 4 po.
Halos ganun din ba? 3-year-old?
Halos nagkakasunod din lang
3-year-old
po
po,
sila.
toddler good.
So, almost ano lang naman ano. So, actually, ang pinaka itatanong mo sa parents, especially if you want to elicit some changes of behavioral emotional changes, regression, ang itatanong mo sa parents actually ay, okay, have you noticed something that isn't right for the child? So, yung tinatawag natin na mother instinct, you can ask the mother kung may napapansin ba siyang naiba. So, tingnan natin sa HPI ng patient natin. Okay, for the HPI, GD was apparently healthy without medical history until 1 month prior to consult, when he could hardly sleep at night and having nightmares when he did not get to sleep. When he did get to sleep, nakakaroon sila ng mga nightmares. And from schools and gets uninterested mingling with classmates. Then, 3 weeks prior to consult, he had constipation and soiling at night with stool mixed with blood. The doctor in the health center gave lactulose to relieve the constipation. Likewise, GD also had bedwetting at nighttime. Okay. Then, 1 day prior to consult, the informant noticed yellow stain on his underwear, and upon checking the child, there was yellowish urethral penile discharge, and hence the consult. So what are the pertinent in the HPI? Of course, ang pertinent dito sa ano natin ay yung urethral discharge, yung genital complaint in a child who manifests with behavioral changes o pumasok yung siya ng nightmares, school inattentiveness, and meron siyang withdrawn behavior. Also, regressive attitudes, yung soiling and bedwetting, which should already raise concern for child sexual abuse. But for a kid who can already speak, like our patient, ang patient natin is an 8-year-old, there is a need for a brief and private conversation between the primary health giver and the child, where the child can have an opportunity to speak in his own words without the parent speaking for the child. The conversation should begin with topics that are interesting and not threatening for the child, like topics about school, favorite cartoons, ang uso natin ngayon, favorite Marvel characters. Ano ba mga Marvel characters natin? Spider-Man, Iron Man, Captain America. So yun ang mga Marvel characters natin. So, para at least ang pinaka-purpose mo dito ay para makakuha mo yung rapport with the patient, with the child. So you should be patient and friendly. And if you, the doctor, has already established the desired level of relationship, then the doctor can ask the child if he knows why he has been brought to the doctor, kung bakit siya dinala ng mother niya sa kanya. At pwede mo munang matanong ang bata if anyone has ever touched him in a way that make him feel uncomfortable. So, ang tanong ko ngayon, why do we need to establish child sexual abuse? Okay, group 5. Check ko lang kung nandiyan na sila. Group 5, are you there? Wala pa rin. Wala pa rin, press. Group 5, wala pa rin. 2 meetings na ba sila? Kaya natagalan sila ngayon. So why do we need to establish ang child sexual abuse? Okay. According to statistics, child sexual abuse is more common than childhood cancer, juvenile diabetes, and congenital heart disease combined. And as a physician, you're obligated to report the case within 48 hours. Tama ba yun, Renz Sale? Yung report po kanina, it should be
Yes po,
reported
Doc.
within 48 hours to
Pag po,
pwedeng DSWD or local social welfare and development officer or Commission on Human Rights or PNP or ang pinakamadali sa siguro natin may report sa barangay kagawad, pwede din yon. And you have to tell the family why you are doing it and that you are required by law to do so, yung reporting. Because failure to report a child abuse shall be punishable, a fine of not more than, ilan yung sabi mo kanina, Renz?
2,000 pesos po, Doc.
Uy, ang late lang naman pala, no? A fine of not more than 2,000 or as may be determined in the future by a court with jurisdiction. Ang tanong ko rin, sito bang 2,000? Ano bang reference mo nito? Or anong source mo? What year? Kailan pa ito? Ito ba ang latest natin?
Ano po, Doc? Published po siya ng, ano po ang title po is Protocol for Case Management of Child Victims of Abuse, Neglect, and Exploitation. Tingnan ko po yung year. Pero ano po ito 20...
Doc, nasa ano po yan? President Decree 603.
So anong year?
Presidential Decree 603, Article 166. Yung 24 hours to 48 hours.
What year? Okay, anyway, basta alam natin may multa pag hindi ka nag-report 2,000. So baka mas malaki na kung matagal na yung yun. Other than that, aside from reporting, it is also your legal responsibility as a doctor to ensure that the victim will be safe and protected from abuser. And you have to separate the abuser from the child. So, kung walang alternative or safe alternative, then you can even hospitalize the patient. Kung hindi mo kung halimbawa, ang kanyang suspect mong offender within the household, pwede mong i-separate siya sa ibang kamag-anak or pwede mong i-hospitalize daw. Okay? But sometimes the abuser is not a stranger. It can be a family member or someone close to the family. So, ang tanong natin dito, so who among these adult has the disease or with sexual transmitted infection. So kung isa pag kasama sa bahay, mahirap iyan eh. So dapat matanong mo, dapat siguro maganda siguro kung yung informant is aware ng mga aktibidad na kasama niya sa bahay. Okay? Because urethritis in men, as a general rule, ano bang sabi natin? Pag ang urethritis who are younger than 40 years old who have not undergone invasive procedure like what? Catheter insertion, ano ba, cystoscopy or urethral dilatation can be presumed to be sexually transmitted infection. So kung mayroong kasama siya sa bahay na may urethritis, assume na ito ay STI, especially if more less than 40-year-old. And some men with urethritis never develop any symptoms. So baka mahirapan talaga, no? Kasi some of these men may not have symptoms. And yet, even for those asymptomatic urethritis, they also carry the same risk as the symptomatic urethritis. They can also develop complications, and they are also with risk of transmitting the infection to others or transferring the disease to others. And in some cases, screening is the only means to detect infection of urethritis in men. Okay. So, you should have high index of suspicion as to who among the family member or family friend has STI. So, we are interested of knowing who was the risk for who was the risk for STI. So tatanong natin yung kanilang mga sexual behavior. So we'll ask about unprotected intercourse. Sino kaya ang mga kasama niya sa bahay na mahilig magkaroon ng mga casual sex, kaya mayroong multiple sex partner? Or those with new sex partner, may bagong ka-sex partner? Or siguro single sex partner, but then yung partner na yon na may with concurrent partner or partner with STI. Okay. Then history of STI and early age of first coitus. Bakit kaya? Kapag may history daw ng early o yung kanyang first coitus ay at early age, bakit at least for STI? Sige nga, group 5 again. Just checking kung nandito na. Group 5. Wala pa rin. Wala, di pa rin tapos. So, bakit kaya? Sino ang makakasagot? Anyone? Ito yung mga risk factor for STI among adult. Kasi ito ang titingnan natin sa mga adult members na pwedeng offender ng child sexual abuse. Bakit? Ano sa tingin nyo? Sige nga si President. President, bakit sa tingin nyo? Early age of first coitus ay at risk of sexual behavior. Pwede yung maturity niya, parang ano siya, pwede. Isa pa, ang sinasabi nila, those who initiate intercourse at an early age, they are more likely to use alcohol. Kaya di ba, kumisan, nalasing, kaya nagkaroon ng problema, di ba? So, and adolescent alcohol is associated with STI. So yun, because of alcohol use. Okay? And then, yes. Ano yan? May akala ko may. And then MSM. What is MSM? men who have sex with men. So he can be gay, bisexual, or even heterosexual who engage in sex for what? Usually itong mga heterosexual, they engage in sex for money or in exchange for money or drugs, yung tinatawag natin na trading sex, trade sex, di ba? Kung if you need money, if you need drugs, minsan, itong mga state na ito, they engage in MSM to get yung money kung estudyante. Okay? So, sabi nga natin, we just hope that the informant knows the sexual behavior of the members of the household, but at least we can at least maano natin sino kaya who among them ang offender, kasi yung ano na nga natin, we have to separate the child to the offender. Okay? So for the past medical history. Okay? Anong pertinent dito? Sabi namin sa case sa grupo namin, itong negative eczema can be pertinent. Kasi kung meron kang eczema, baka na naman merong allergy yung bata at nagkaroon ng allergy doon sa penile niya at nagkaroon ng irritation na nagkaroon ng urethritis. So negative naman yung eczema. What about the UTI in 2018? Is this pertinent? Group 5. Wala pa rin ba? Wala pa. Group 6. Bakit pertinent yung UTI in the patient? We are referring now to GD in 2018. Why?
Kasi Doc, yung yung tawag doon, yung gonorrhea po, yung primary infection, pwedeng, yun yung UTI po.
Yung gonorrhea, pwedeng maling sa okay. Okay, bakit natin inisip, pwede naman magkaroon ng UTI, pero bakit inisip natin na baka hindi UTI? Di ba? Kasi napag-aralan natin sa case sa module natin last week ba yun, or 2 weeks ago. In males, most UTI occurs during the first year of life. Much more common in our uncircumcised males. So, common ang di ba common ang UTI sa female? So, common lang siya sa male before 1 year old because of, sabi natin, anatomic problem, congenital problem. And common din siya sa mga uncircumcised males. Kasi, pag uncircumcised male, sabi ka nga natin, pwedeng magkaroon ng hindi ba siya nakakatuloy yung urine and then pwede mag-result to UTI. Di ba? Actually, 10 times more common than the circumcised boys. But for this patient, si GD natin ay circumcised siya at 1 year old. So, GD is 8 year old. Sabi nga natin, uncommon yung UTI. And boy siya. Sabi nga natin, common siya sa girls. Ang UTI. And then circumcised naman siya. So, ang tanong natin ngayon, so, di ba very low ang incidence ng UTI dapat? Ang tanong natin ngayon ay, UTI kaya yun? Or urethritis? At that time, 2018. Sabi nga natin, ang urethritis may also produce the same symptoms as UTI. Di ba? You can also have dysuria. So, hindi kaya yun, hindi kaya yun ay urethritis na. Okay, sabi nga natin, children who have urethritis may present with irritative voiding symptoms such as dysuria, urgency, or frequency, just like UTI. So, bakit kailangan natin alamin kung UTI yun or urethritis? Ano kung urethritis? Alarming siya, di ba? Kasi, kung urethritis na yun, hindi naman talaga UTI, ibig sabihin, merong long history of sexual abuse. Kung 2018 yun, that was already 3 years ago. So 3 years duration of sexual abuse. Okay? Ituloy natin. For the family history, mother, 35-year-old with hypertension and diabetes, Yung father niya, 36-year-old, with hypertension. Pertinent ba ito? Yung family history. Sa grupo namin, sabi namin, parang uncontributory. Unless may ibang grupo na nagsasabi na pertinent siya. Wala naman ano. Meron ba? So more of, hindi siya masyado. Ang ano natin, yung social history, dito tayo talaga very interested. Okay? Yung mother is a cashier in a restaurant, Tabaco City, separated from the husband in 2014, but 7-month pregnant. Okay, 7-month pregnant. So ibig sabihin, meron siyang bagong kinakasama na hindi father ng pasyente natin. So baka may stepfather yung 7-month pregnant 2014 pa hiwalay. And still works yung mother as her husband has no work. So husband dito referring na sa present na kinakasama. So walang work. So pertinent ba siya? Pertinent ba? Anong pertinent dito? Sige nga. Group 2. Anong pertinent dito? Sa information na ito. Di ba? Nag-ano tayo mga investigative tayo Group 2.
Siguro po, Doc, mas wala po yung mother dun sa bahay, tapos mas nakakasama yung stepfather ng bata.
Okay, yes. Yung stepfather niya, no work, so GD is left under the care of the stepfather when their mother is at work. Di ba palagi tinatanong natin, pag sino ang palaging kasama ng bata? Yun ang unang tinatanong natin. So pwede palaging kasama ng bata yung stepfather. So isa na yun na pwede magsuspit sa tayo. Ano pang pertinent dito? Sige nga, group 4. Ano pang pertinent sa social history natin? Group 4. Yes. Nag-synthesis ito hindi ako magle-lecture. Sabi ko nga, pag synthesis, nagsisynthesis. Hindi nagle-lecture about STI. STI kayo na magbasa nun. Ako ay magsisynthesis.
Pregnant po, Doc, yung mother.
Ha?
Pregnant po.
So ano kung pregnant yung mother?
Kung since suspect po natin, Doc, na possible na possible sexual abuse or urethritis, and yung possible na yung stepfather yung source, pwede pong mahawaan yung mommy and yung
buntis yung asawa, may nagkaroon ng pwede siyang offender. Bakit? Ano yun? Paliwanag mo kung ako ay nasa hukom.
Pwede po kasi, Doc, na mahawaan po yung baby and si mommy nung kung source nung
nahawaan si mommy. Yung pasyente natin 8-year-old na. At ang
sa po, Doc, sa possible source po kasi yung stepfather nung infection, Doc. So if ever man po pregnant si mommy, pwede pong mahawaan siya ni stepfather. Tapos, yun po.
Mahawaan yung stepfather?
Hindi po, baliktad po, Doc. Si stepfather po yung source. Pwedeng source.
Siguro ba gusto kang sabihin, pero hindi mo na kung ano, yung pagbubuntis at yung nahawaan, hindi mo na kung bakit. Sige nga, group 6, bago ko tawagin yung group 1. Group 6, bakit? Anong pregnant? So pregnant, ano kung pregnant? Bakit? Kasi nagbibilang tayo ng mga parang evidence na tayo we are proving. Una, palaging kasama. Pangalawa, buntis si Mrs. Ano ngayon kung buntis si Mrs.? What? Group 6.
Maybe because the perpetrator is sexually active.
Then?
And yung nabuntis yung yung lover is of course the perpetrator.
So, okay. Pregnant yung mother. Ang sabi, research shows that half of women are scared or uneasy to have sex while pregnant and fears that it could harm the baby. Diba? So, Because of this, may na pwedeng dahil takot makipag-sex na si mother, yun. Kasi pero ito, harm na baby. Hindi naman ito totoo, di ba? May asawa. Sino may asawa dito? Si Villanueva. Totoo ba ito?
Ayaw na, sir.
Totoo ba? When you have sex with your wife, na pregnant siya, it can harm the baby?
I'm not very sure if I can answer that question, sir.
Ibahin ko na lang yung takot. Ibahin ko na lang yung tanong Villanueva. Takot ka ba? Takot ka ba, Villanueva? Kapag
No, gabi na yan, do.
Gabi. Hindi naman, Doc.
And you are making the discussion interesting, hindi lousy. Ang tanong is, are you afraid?
Actually, sir, kasi nurse naman ako. Ano naman, sir, na hindi naman kami takot. Kaya lang,
kasi,
control.
Kasi, okay, hindi naman kasi siya totoo. Kasi the baby is protected by the amniotic fluid in the uterus. Okay. So, sabi nga natin, dahil nga dito sa anong ito, pwedeng yung father niya, yung stepfather niya, yung sex desire ng father niya, baka sabi mo nga kanina, baka yung father niya malibog, was transferred to the child. If the stepfather is, sabihin natin na horny or libidinous or lewd, yun. Okay? So, pertinent siya. Okay. Ngayon, ito lang yung sabi natin, baka lang. Kasi nga, dahil buntis o asawa at palaging kasama. Ngayon, huwag tayo masyadong judgmental. Tanungin talaga natin. Sa tingin ba natin, yung stepfather is capable of doing the crime? Di ba? Yun ang concern natin. Sa tingin natin, ano bang aktibidad ng stepfather? Di ba? Tatanungin natin yung mother. Okay, sino bang yung stepfather niya? Yung stepfather niya is 30-year-old. Younger than the mother. Yung father niya, yung mother is 35. Yung bata, 30-year-old. Sabi ng grupo namin, ewan ko lang kung mag-agree yung iba. Sabi ng group namin, lalo na si Josh, pag 30-year-old daw, libidinous. Okay.
Dok, wala ko sinabing ganyan. Si Dok talaga.
Sabi ko ganyan. Okay, so hindi pala pertinent yung 30-year-old. Okay. So live-in partner since 2016. Okay. And then seafarer for 8 years in cruise ship as lifeguard, comes home every year, repatriated due to COVID pandemic in March 2022. So anong pertinent dito? Kung hindi yung 30-year-old pertinent, anong pertinent? Okay, ano lang natin? Domestic partner, yung partner niya ngayon ay hindi niya husband. Domestic partner siya noong 2016. So ano bang natin ito? Di ba si GD ay nagkaroon ng UTI noong 2018? 2016 pa naging kasama niya. So baka naman talaga yung 2018 talaga yun ay urethritis na talaga, di ba? So pertinent yung natin na 2016. Paano pang pertinent dito? Yes. Group 5. Nandiyan na ba? Ayaw mag-join ng group 5. Nandiyan na. Okay, group 5. Welcome. What pertinent? Because we are now proving if the stepfather is capable of doing the crime. So, ano pang pertinent dito? Group 5. Group 5. Sino ba nga sa group 5? President. Tawag ka na lang. Wala sa akin yung listahan. Quincy.
Hello
Quincy.
po.
Okay. Ano
Yes
pa dito
po.
pertinent? Ano pang pertinent dito?
Andito lang po, ito pong nasa screen, Doc, yung tatanong.
Yes.
Yung repatriated po yung stepfather due to COVID pandemic.
So kung repatriated, bakit siya capable of doing?
Kasi po, nasa bahay lang siya. Tapos considering na yung mother is yung nag-work since wala siyang work currently.
Okay, so talaga ibig sabihin kasama niya. Okay, what else? Ano pa? Sino pang kasama mo sa group 5? Tawag ka pa.
Si Kurt
20.
po.
Sino?
Si Kurt po.
Si Kurt. Kurt. Okay, dati din sa grupo ko. Kurt, ano pang pertinent dito?
Ang ah
Hmm. May pertinent pa ba? Wala na. Wala ka na ma-pinpoint? Ay, isang member na lang ng Group 5. Sino pa ang Group 5? Before I proceed. Sino pang tatawagin mo, Kurt?
si Gibo po.
Oh, Gibo. Okay, Gibo. Oh. Ano pang pertinent dito?
Na siguro po yung yung job po ng stepfather. So, cruise ship, lifeguard sa isang cruise ship siya dati, Doc. So,
pertinent yun. Bakit naman pertinent yun?
Yung activities, Doc, ng stepfather. So, di natin alam, Doc, yung
Dahil sa trabaho niya as lifeguard.
Mga pinagagagawa, Doc.
Hindi alam. Okay. Pwede. Kasi, di ba ang sabi ko nga kanina, we are proving the possibility of sexual abuse. So, any small information can be used as supporting evidence, di ba? So, siguro kung sa ordinary other cases, hindi tayo masyado ganito masyadong nag-iisip, naging judgmental. But here we are proving. So, sorry for those with relative who are seafarer, di ba? Seafarer yung niya. Baka merong mga father dyan this is just lang ito because we are here approving. We are here to prove. Okay? Sabi, ang seafarer, lifeguard, cruise ship worker ay bang sabi? According to literature review, sex among cruise ship worker is pervasive. They can have aggressive sex activities like multiple sex partner, orgy, sex with men, which are risk for STI. So mahilig siya doon. Ang sabi nga, nailagay ko nga dito, the issue of sexually transmitted diseases among seafarers is as old as navigation itself. Okay? Okay, pero naging judgmental tayo dito ngayon. Okay, di ba parang pa tayo? Yung una, may mga naisip na tayo. Ngayon, dahil sa trabaho niya, napapag-isip pa rin tayo o baka dahil mental tayo. Pero gusto talagang alamin natin sa informant, ano ba talaga ang sexual activity ng partner niya? Di ba? Kasi lahat naman sinabi natin, lang ito indirect about the sexual behavior ng kanyang kinakasama. So sige nga, kung matandaan niyo pa yung ating case, so ano bang sinabi ng sexual ng informant natin about yung sexual activity ng kanyang asawa? Sige nga, kung nagbasa kayo ng case. Group 3.
The mother revealed po, Doc, that her partner seems to have sexual encounters dahil may mga nakita po siyang empty box of condom dun sa luggage niya.
Okay, very good. So, sabi nga natin, yung sabi nga natin lang ito, pwedeng dahil sa trabaho niya. Pero talaga gusto natin alaman, ano ba talaga activity? So, ang sabi ng na pwedeng the mother revealed that her partner seems to have sexual encounters while on cruise as she found empty box of condom in the luggage. So, pertinent siya, di ba? Bakit pertinent? Yung empty box of condom, bakit pertinent? Unang-una, okay? Ito yung lang ng condom. Hindi ko alam ang available sa Pilipinas. Juice?
Gabi, sure ka na dyan, Doc?
Nagkaroon lang. Okay, empty box of condom. So, pertinent siya, di ba? Bakit? Nagpapahiwatig lang na pwedeng meron siyang multiple sex partner. Pwedeng meron siyang mga casual sex partners. Or hindi lang isa ang partner niya, multiple sex partner. Ano pa? Bakit pertinent pa yung multiple empty box of condom? pertinent yun. Kasi hindi lang condom ang nakita pa empty box. So pag empty box, baka inconsistent use of condom. Pwede, di ba? Naubusan, baka nagkaroon siya ng sex na wala na siyang condom, naubusan. Okay, so pertinent din siya. So inconsistent use of condom and multiple sex partners are both risk for STI. Okay. Ngayon, okay, meron na tayong lumalakas na yung ano natin. Yung baka nga talaga yung ano niya, yung stepfather niya. Ngayon, nakakuha pa tayo ng another information. Status post tonsillectomy 2018. Okay. Is this pertinent? Contributory ba siya? Bakit? Bakit pertinent?
Indicative of sexual act through the mouth.
Pwedeng ano. So, to the mouth.
Pwede po, Doc, may recurrent infection, parang immunocompromised po yung patient. Ay, yung stepfather.
So, pwede mo na ito. So, okay. Yan natin yung sabi niya isa kanina. So, baka meron siyang, sabi, di ba, ang reason ng kanyang status post tonsillectomy dahil meron siyang recurrent tonsillitis. Baka naman ito ay more of pwedeng sign na rin siya ng pharyngeal gonorrhea, di ba? Might be an early signs of STI. So, Neisseria gonorrhea, aside from infection of the genitourinary tract, it's also an infection of the mucosa of the oropharynx. Okay? Other than yung mga, sabi natin, yung ating rectum, ang ating pwede rin siyang infection ng oropharynx. So, ang tanong, kung yung kanyang stepfather nagkaroon ng recurrent tonsillitis, sabi natin baka yun ay already a pharyngeal gonorrhea, ang tanong, how do you get pharyngeal gonorrhea?
Relation ko, Doc. Yung oral stimulation of the male genitalia.
Okay. So, you can get pharyngeal gonorrhea by oral genital exposure. Pwedeng cunnilingus or fellatio. What is cunnilingus?
Stimulation po ng female genital organ.
So, oral contact with the vagina. Fellatio naman, oral contact with the penis. Okay. So, ano ang sabi ng Harrison? According to Harrison, fellatio is more efficient mode of transmission of pharyngeal gonorrhea than cunnilingus. Okay. So, ang tanong natin, does the stepfather engage in sex with men or MSN? Baka. Di ba? Kasi fellatio daw, more kahit naman siguro straight siya, di ba? Usually, pag mga nasa ibang country ka, you want to, mas gusto mong kumita. Baka yung sinasabi ko kanina, yung sex trade, yung trading sex for money. So, it's probably trade for sex for more income while abroad. Baka nag-engage siya sa MSM. Okay, so nagdududa tayo na baka nag-engage siya sa fellatio. Ngayon, okay, nagkaroon siya ng UTI, testicular pain in March 2020. Okay, pertinent ba? So kung 2020, ilang taon siya? Ilang taon ng pasyente natin? Last year lang So 2019, so last year, so 29 pa lang yung patient natin. So anong sabi tungkol sa UTI in 29? Parehas na sinabi natin kanina, di ba? Pero ito UTI is rare in adult males younger than 50 years of age and increases incidence thereafter. Ito yung dahil ito yung sabi natin kanina na rare siya sa lalaki. Pag 50-year-old, more than 50-year-old, yung incidence ng UTI halos parehas na because of prostatic enlargement. Di ba yung sabi natin nung magkaroon tayo ng renal module? Okay. Pero itong ito yung gusto kong sabihin mo. Rectal intercourse often cause Enterobacteriaceae and usually no urethritis but do have bacteria. Okay. So pwedeng hindi nga talaga yun urethritis, talaga naman talagang UTI siya because of bacteria, o baka naman nag-engage siya sa, anong sabi dito? Rectal intercourse. Okay, so yung father nag-engage sa rectal intercourse and then nagduda tayo, nag-engage din siya sa fellatio, so baka nag-engage siya sa MSM. Okay? So, inaano-ano natin, nagdududa tayo. So, kasi ang sabi natin, MSM is a risk factor. At pag MSM, mas marami ang ating diagnostic test na gagawin sa father. Di ba? Sa stepfather kung sakali man. Okay, other than UTI, meron din siyang testicular pain. Okay, ano yung testicular pain na yon? Baka meron siyang epididymitis. Okay, anong sabi ng book about, anong sabi ng Harrison about having epididymitis? Ganon din. Men who practice inserted rectal intercourse is a risk for epididymitis, most frequently chlamydia trachomatis or Neisseria gonorrhea. Okay. So, ano pa natin? So gonococcal epididymitis is more symptomatic. O, di ba? Sabi niya, testicular pain. So more symptomatic. So baka talaga yung patient natin ay meron ng gonorrhea noong 2020 at nagkaroon na siya ng gonococcal epididymitis. Di ba? So, versus chlamydia epididymitis, more asymptomatic yung chlamydia, yung ano natin, chlamydia epididymitis. So, more of gonococcal epididymitis. Okay? Next. Okay. Ngayon, sabi natin, yung stepfather has several risks for STI. Nabanggit na natin yung multiple partner, inconsistent use of condom, and then yung sabi natin na medyo ano lang, yung sick-rare, and yung sabi natin na pwede nag-engage siya sa MSN because of UTI and testicular pain, na pwede nag-practice siya ng inserted rectal intercourse. At ano pa ba? Oh, meron siyang symptoms of STI. Ano ito yung symptoms of STI natin sa stepfather? Yung recurrent tonsillitis, di ba? Yung dysuria. At yung epididymitis pa rin. So ito yung mga several symptoms of STI. Ngayon, ang next na tanong natin ito? Sige nga, kung kayo yung nag-iimbestiga, nakakakuha na tayo ng picture na pwedeng yung stepfather ang may kagagawan dahil siya ay may risk for STI at merong siyang simptoma ng STI. Ano ngayon ang next na gusto mong alamin? Okay? Group 3. Oh. Anong next na natin gustong alamin mo sa history? Tingnan nyo, nasa case natin. Nandoon. Anong gusto mong alamin na ngayon? After we have established na pwede yung father yung kanyang perpetuator, anong gusto mong alamin? Na part na rin ng, ng pwedeng behavioral changes, ganun. Yes, group 3.
Yung relation.
Yes. Ngayon, gusto natin malaman yung relationship ng stepfather with GD. So, ang sabi doon, GD is not talking as much as usual. Takot at umiiwas mula pa ng 2018. Di ba nagkaroon siya ng UTI ng 2018? Okay, so talagang masasabi natin, kung titingnan natin yung yung ating mga history natin, noong 2018, nagkaroon na siya ng behavioral changes. Ayan na, since 2018. Nagkaroon siya ng UTI ng 2018. Yung stepfather nagkaroon ng tonsillectomy ng 2082. Ang daming mga circumstantial. Tama ba yon? Circumstantial. Nagpapakalkul tayo. Okay? So, okay. Though the investigative interviewing should be performed by appropriate agencies, if possible, yung mga forensic interviewer, ito ang dapat natin alamin. The medical interview may be admissible in court as an exemption to hearsay. Okay? So, yung interview mo ay importante. Huwag naman, ano lang yung tayo, history lang tayo, concern lang natin yung patient, concern natin about yung sexual abuse. Kasi it can be used in the court. It is admissible. So, careful documentation of question and responses is critical. So, it should be recorded verbatim. So, you can have another, pwedeng meron kang history at meron ka rin another paper for yung verbatim na question and answer. So, it should be documented. Okay? So, how will we proceed with the physical examination in a child suspected of a CSA? Okay? So, it should include a careful recording of any signs of trauma away from the genital area, including careful documentation of any bruises, abrasions, lacerations, ecchymosis, petechia, strangling marks, secondary to restraining force during the act, and for GD na nagkaroon siya ng constipation, anong i-check natin doon? Sige nga. Di ba yung patient natin mayroong constipation? Ano ba ang gusto natin i-check sa patient? Yes. Group. Yes, ano ba? What in the PA? Gusto natin alamin. Meron siyang constipation eh. Di ba? Away
Baka
from the
po
genital.
meron siyang retentive behavior due to kung may pain siya doon na felt sa anus niya.
So ang i-check natin doon ay kung meron siyang laceration sa anal area, secondary to abuse, di ba? Baka naman may ginagawang inserted sex yung kanyang stepfather. And then because of that laceration, nagkaroon siya ng voluntary withholding of defecation that now result to constipation. And because of the constipation, may nabanggit to na about soiling, di ba? Nagkaroon siya ng soiling. Yung sabi nga natin, yung soiling can be part of the regressive behavior, yung ating psychological component nga, sabi natin regressive behavior. But then, yung soiling din, yung pag sinabi natin soiling, ano ito eh, parang liquid stool. So, pwedeng yung liquid stool leaks around the retained impacted stool doon sa rectum, di ba? So, pag meron kang matigas na tayo doon, pwedeng yung tayo sa taas, pwedeng mag-leak out, dadaan sa gilid, so magkakaroon siya ng soiling. So, dapat natin i-check kung merong laceration na pwede nag-produce ng pain para masabi natin siya may withholding of defecation. Ngayon, ito ang dapat natin tandaan. A normal genital examination does not rule out the possibility of abuse. Why? Because the injuries are often completely healed by the time a child presents for medical evaluation. So this accounts for the rarity of positive findings and that physical injuries caused by abuse becomes less evident over time. Hence, the most important piece of information in determining the likelihood of abuse is the child declaration. So this is very important. So it should be reflected in the history. Okay? So gagawa tayo ng PE, kapag normal yung PE natin, hindi wag tayo magsabi, wala naman pala itong mga signs of abuse, hindi na ito CSA. Sabi natin dito, genital injuries can usually heal rapidly. Okay? Okay, for this patient. Okay. Inflamed tonsil, cervical lymphadenopathy. Okay, normal naman. Genitalia niya. Okay, meron siya perianal tears at hematoma. Okay, ano mga pertinent? At meron siya fever, So, ang pertinent natin yung inflamed tonsil or cervical lymph and cervical lymph adenopathy. So, hindi kaya sabi natin ito ay gonococcal tonsillitis or pharyngeal gonorrhea or throat gonorrhea. So, gonococci daw have been isolated in the oral pharynx of young children who have been abused sexually by male contact. Kaya palagi natin itong i-check yung kanyang throat kasi often involved sa sexual abuse yung yung pharyngeal gonorrhea. Okay? What else? Anong wala o meron doon sa PE natin, sa SEENT na dapat natanong natin? Or dapat nag-reflect sa PE? Ano? Yun na nilagay tonsillitis lang. Anong importante pa? Sige nga, what other things? Very important, especially in a case of an STI. Maki,
Yung bruising doc dun sa palate.
Ano yun sa palate?
Kung may bruising, kasi po, meron po.
Bruising sa palate? Dahil related na rin siguro dito, dahil sa bruising sa palate. Pero what else? Ano other than bruising siguro? Ano pa?
Infection po, Dok, sa eye.
Infection sa eyes. Okay, pwede
Sa
din.
eye po, yung top.
Okay, so pwedeng ano din. What else?
Yung oral thrush.
Ano sa mouth? Sa oral?
Thrush po eh. Presyo.
Ano yung hindi natin about ulcer? Di ba? Kung merong mga oral ulcerative diseases doon. Or, pag may mga ulcer. Because oral ulcerative diseases can be associated with what? Herpes simplex virus and syphilis. What HSV? 1 or 2?
2 po.
SSB, sabi nga kanina sa report, pag SSB daw, above the, above the waist. Sino nag-report kanina sa grupo? Pag SSB2, below the waist, yun ba yung report kanina?
1 po pag oral herpes.
1 pag oral.
Okay. So, ang natin, pag SSB1, oral. But SSV2, yes, genital infection, but may manifest with orolabial infection, though rare, and is almost associated with genital infection. Okay? HSV2, you can also have orolabial infection lang. Hindi lang HSV1. Kahit sa 2, meron din. Pero, kadalasan, hindi siya isolated. Kadalasan, may kasama na talaga siyang genital lesion. Associated with genital lesion. Okay? Okay. So, paano mo ma-differentiate pag ito ay HSV or syphilis? Ano ba ang ulcer associated with HSV? With, yes, herpes simplex virus or human herpes virus or HSV. Kadalasan, pag HSV, ang ulcer niya ay small, superficial, and painful. Kapag syphilis naman, especially kung ang cause niya yung primary lesion, ano yung primary lesion natin? Yung chancre, di ba? Usually, ang lesion niya is indurated and non-tender. Okay? Next, ano pa ang pertinent natin dito? Circumcised yellow urethral discharge. Okay, na banggit natin ito kanina. Circumcised naman yung patient at may yung urethral discharge. Sabi nga natin, urethritis. Okay, meron siyang perianal tears or hematoma. Sabi nga natin kanina, pwede mag-resolve to because of trauma, because of inserted rectal text that can explain the pain and constipation, di ba? And pwede rin na itong ano ito, meron siyang hematoma. Dapat check natin kung ito ba ay tears lang or hematoma o baka naman meron na rin doong secretion. Baka meron na rin siyang gonococcal infection of the rectum. Okay. So ano na yung working diagnosis natin? So ang working diagnosis natin, may klase kayo mamayang 1 o'clock?
Meron
po,
po.
Doc.
Uy, bilisan na natin meron. Okay. Hindi na ako magtatanong. Okay, ang working diagnosis natin ito ay urethritis probably secondary to STI. And then huwag natin kalimutan na meron siyang tonsillitis, also probably secondary to STI. Sinasabi natin na probable kasi kaya sinasabi din natin secondary kasi kailangan pa natin mag-diagnostic test, di ba? Kung talaga yun ay sexually transmitted infection, yung mga sa throat niya at sa urethra niya. And kung talaga na meron siyang etiologic agent associated with STI, then ang sabi, if there's ever any STI in the child, there's been sexual abuse. Okay? Pwede na kayong kumain na habang ano ko. Okay? Urethritis, okay. Sabi natin sa lecture natin, sa mga SGD natin, urethritis is an STI syndrome and is characterized by inflammation of the urethra, either caused by Neisseria gonorrhea and urethritis not caused by gonorrhea or the NGU, and the most common is the chlamydia trachomatis. The most common NGU, chlamydia trachomatis. The most common urethritis is still chlamydia trachomatis. Tama? The most common urethritis ay chlamydia trachomatis. Neisseria gonorrhea comes second only. Huwag yung kalimutan niya na. Ang pinaka-common natin yung chlamydia trachomatis. Other NGU pathogens include Mycoplasma genitalium, and this is consistently implicated as a probable cause of any chlamydia negative NGU. Kaya pag negative, hindi siya dito, di ba? Negative siya, negative dito, inaano natin siyang Mycoplasma genitalium. Okay? Next, Trichomonas vaginalis or trichomoniasis. Most people with trichomonas, they will have itch or sometimes may not show any symptoms, making the diagnosis of trichomoniasis difficult. And it can last several months or even years at hindi siya nawawala on its own. At kapag pinabayaan natin, it can lead to severe health problems as trichomoniasis infection is closely tied to co-infection with HIV. So, it will ease transmission of the virus that causes the AIDS. Next, HSV1 and then human herpes virus. So they can both cause orolabial herpes and genital herpes. Genital herpes yung 2. So yung orolabial herpes yung 1. And then adenovirus at urea plasma mycoplasma. Urea plasma rheolatico and mycoplasma huminis. Anong sabi sa book about these two? The role they play remain unproven. It can be transferred during sexual intercourse, but they are not classified as STI. Remember that? Hindi ito classified as STI. They can live in the mucosa found in the oral genital tract. So, pwede maging normal flora din ito. Okay. So, how will we differentiate the discharge from GU and NGU? For GU, it produces more abundant and virulent discharge and tends to be more severe symptoms. The incubation period is short, about 2 to 3 days only, and may present with burning, with urination in itch. So don't assume dysuria in a male is always a UTI. Okay? You suspect urethritis, hindi siya UTI. For NGU, the discharge is scanty to moderate, more of mucoid or serous or watery. 80% are more asymptomatic. No spontaneous discharge is evident or just minimal. But sometimes, clinically, you cannot reliably distinguish GU with NGU. The quantity and the appearance can only be used to distinguish between the two in a patient who have not urinated within the previous 2 hours. Kung ihi naman siya ng ihi, kahit naman siya ay GU, hindi mo makikitang abundant kasi nga nawawas out palagi. Nawas out na. So okay lang siya kapag ang pasyente ay hindi nag-urinate for the past 2 hours. Madi-differentiate natin yung quantity and the appearance. Besides, yung pag-differentiate naman, not so, kasi nga, 60% of GU or gonococcal urethritis may have co-infection with chlamydia trachomatis. So nagkakaroon ng dual infection anyway. Okay? For the diagnostics, ang ginawa sa patient natin ay, okay, huwag na natin i-discuss yan. Basta alam lang natin, 2 numerous to count, urethral inflammation. And then, gram stain, gram-negative diplococci. Okay. Anong sabi natin with gram stain? Okay. The gram stain can be useful in the initial evaluation of patient suspected with gonococcal infection. And it is highly specific, 95 to 98%, as well as sensitive, 90 to 98% in males with symptomatic urethritis. But the sensitivity for asymptomatic males is low, just 60%. Makinandyan pa kayo? Kasi baka nakata ko.
Yes po, Doc.
Okay. Okay, tuloy natin. A presumptive diagnosis of gonorrhea can be made by identification of gram-negative intracellular diplococci within the WBC or within the polymorphs in the urethral discharge. Okay, ito hindi ito baka kala natin ito ito yung malilit na yan. Yan yung mga diplococci, dala-dalawa. They look like 2 coffee beans kissing. And highly sensitive and specific, kaya an absence warrants a preliminary diagnosis of non-gonococcal urethritis. Okay. Another diagnostic test is nucleic acid amplification technique or not. I don't know if this is locally available. Sino medtech natin? Available ba ito? Okay. Basta, alam lang natin, this is more, it has an advantage that it is more superior to culture. Okay. Mas superior to culture. Though, there are false negative results with NAT because some subtypes of Neisseria gonorrhea may lack specific sequences targeted by the NAT. And this test uses wide variety of specimen. It can use first voided urine and urethral swab. And NAT test may yield positive when negative for gram stain for Neisseria gonorrhea, pwede itong mag-positive itong NAT. Okay? Meron din tayo tinatawag na multiplex NAT. Ano siya? Combination. Simultaneously assessed infection with Neisseria gonorrhea and chlamydia trachomatis. As NAT is highly sensitive in specific tests, a negative NAT is then classified as ano? Okay? A negative NAT So negative for gonorrhea, negative for chlamydia trachomatis. Then the urethritis is classified as non-specific urethritis or NSU. So actually, this is a diagnosis of exclusion after gonococcal and chlamydia have been ruled out. There are a lot of different organisms can cause an issue, nabanggit natin kanina na, yung Mycoplasma genitalium, Trichomonas vaginalis, SSV, and adenovirus. Okay. Okay. Two positive NATs may be substituted, take note, may be substituted for culture of the urethra or the cervix as legal evidence of CSA. So, the preferred method is still, okay, di ba sabi natin, pwede lang itong option lang siya, can substitute lang yung 2 NATs. Still, ang pinaka-preferred ay yung culture. This is the preferred method in children for detection of gonococcal infection for potential CSA. And in most countries, sexual abuse is reported solely on the basis of positive Neisseria culture. So sa ibang country talagang ano lang sila, nice culture lang, hindi talaga yung NAT. Okay. Ang sabi kasi, it is insufficient to recommend non-culture test in cases of sexual assault in pre-pubescent boys. Okay, culture lang talaga. Specimens obtained from the urethra, ito yung pwede natin magagamit for culture, cervix for babae, pharynx, and rectum for both male and ano. Okay. Ano ba ang Neisseria gonorrhea? Okay. Bilisan ko na lang, na-discuss yun na. Alam natin, non-motile, aerobic, non-spore-forming, gram-negative diplococcus with flattened adjacent surfaces. And the optimal growth occurs in 35 to 37 degrees centigrade in a pH of 7.2 to 7.6 and in an atmosphere of 3 to 5% carbon dioxide. Okay. Grow well and chocolate agar and Mueller-Hinton agar. Meron tayong selective medium, Thayer-Martin medium, which contain vancomycin, colistin, and nystatin. Take note, these antibiotics, which inhibits most of the contaminants, which will then allow the growth of selective Neisseria gonorrhea. Okay? So kapag meron siyang ganito, na tatlong ito, at mayroong growth siya, so more of gonococcal. And what is the presumptive identification may be based on the colony appearance as small, convex, translucent, slightly ombunated. Pag sabi ombunated, ano yan? Parang, ano ba? Protuberant? Ano ba? Rounded? Rounded knot, ombunate. With finely granular surface and lobonate margins. So yan ang appearance niya daw. Okay? So what is the disadvantage of culture? So with other tests na ginawa natin ng culture, okay, for gonococcal, more stringent transport and growth requirement. Nabanggit natin yung kanina. Kailangan din itong transport nito, dapat ma-inoculate mo kaagad siya sa media because gonococci do not tolerate drying. As gonococci do not contain capsule. Take note, gonococci do not contain capsule, so they are not they will not tolerate drying. Kaya kailangan ma-inoculate mo kaagad. Compared to Neisseria meningococcus, ito ay merong capsule. Di ba? Ang meningococcal may capsule, ito ay walang capsule. Okay. Lower sensitivity than NAT. So, binanggit natin kanina, ang culture, lower sensitivity ng NAT. and delay in availability of the results. Okay. Anong binigay sa patient natin? Ceftriaxone 250 mg IM a single dose. Tingnan natin, ano bang talagang management of urethral discharge in children? Okay. For GU in less than 12-year-old or less than 45 kilogram, okay, ang nakalagay na recommended, di ba less than 12, ano natin? Ang recommended is 125 milligram single dose stat. Okay? So, ceftriaxone is the first line regimen or the mainstay of treatment for meningococcal for gonorrhea. For gonococcal. Nabanggit ko meningo. For gonococcal. And sabi nga, it always result in effective cure. Okay. For more than 12-year-old or more than 45 kilogram, the recommended is 250 milligram ceftriaxone, and you can also, as an alternative, you can give cefixime 400 milligram. Okay? Ano natin? So alam na, di ba nabanggit ko kanina, if you have gonorrhea, usually merong co-infection with chlamydia. Tama? Kaya, aside from this, dapat binigay din sa pasyente, hindi lang ceftriaxone, dapat merong drugs for chlamydia. Ano yung treatment for chlamydia?
Azithromycin.
Yes. Okay. For less than 12-year-olds, erythromycin. Okay. Ang ina nila erythromycin. Actually, nagtataka ko. Kasi ang azithromycin naman, ano siya eh? Approved na siya sa bata eh. Less than 12-year-old, di ba? Binibigay nga natin sa mga ano, di ba? Meron nga tayong ano, binibigay na natin after 1-year-old. Pag meron kang otitis media, pneumonia, nagbibigay na tayo ng azithromycin sa bata. They are effective and ano din sila. Pero ang sabi ng book, erythromycin daw pag less than 12-year-old. Siguro based on study na lang siguro na yung mga napag-aralan na nila, erythromycin yung naibigay. Okay. Pag more than 12-year-old, azithromycin is approved. Okay? At yung sabi ko sa kanina, approved siya. Pag more than 12 years, pwede na siya sa ano eh. Or ano bang alternative natin? Azithromycin. Doxycycline. Okay? Actually, itong more than 12-year-old, good as adult na rin ito eh. 100 mg BID for 7 days as an alternative. I-check natin later yung pag nag-discuss tayo about the treatment of the father. Okay? Okay, pwede din tayo magbigay ng erythromycin din. Also, erythromycin, doxycycline or azithromycin. Pwede pa rin. Okay? Kung sa bata, may computation tayo. Pag sa adult dose na, 500 mg. Okay. Bakit preferred natin yung azithromycin over doxycycline? Ang sabi natin, bakit mas preferred natin yung azithromycin over doxycycline for chlamydia infection?
Doc, fewer side effects plus sa compliance, Doc, mas maano lang pasyente, Doc, single dose siya, Doc, compared to other treatment regimens.
Mas preferred natin yung azithromycin over doxycycline. Una-una, ito ay for 7 days. Ito single dose lang. Pangalawa, yung azithromycin, treatment siya sa chlamydia, pero maganda din siya, mas superior siya sa doxycycline para sa pag-treat ng gonorrhea na usually co-infection ng chlamydia. Nakuha nyo? So kapag nagbigay tayo ng azithromycin, kami tayo ng azithromycin, at least efficacy niya ng treatment ay mas okay. Okay, may internet connection is low. I hope you're still there. Nandiyan pa kayo, no?
Yes po, Doc.
Yes,
Okay.
po, Doc.
Kasi nagkaroon ako ng plata. Okay. Most cases, 95% of urethritis are adequately treated with recommended antibiotics, leading to rapid resolution of symptoms. Okay? So, tingnan natin. So, ang sabi nga, dahil nga dito, ang sabi, gonorrhea cases need not a test cure. Diba yung mga book nagsasabi na all gonorrhea cases need a test cure. So, tingnan natin kung anong sasabihin ng Nelson and Harrison. Pero kung magbabasa ka ng mga website, all gonorrhea cases daw need a test cure. Okay, tingnan natin kung anong sasabihin ng Harrison and Nelson. Okay? So based on this, hindi na kailangan. 95% eh. Okay. Urethral discharge generally resolves within 24 to 48 hours. Okay, pag nagabot ka ng mga recommended treatment natin, usually, mawawala na yung kanyang discharge 24 to 48 hours. But the dysuria and the urethral discomfort may persist up to 7 days. Mas matagal yung simptoma. All gonorrhea cases, okay, ito yung sabi ko kanina. Ang sabi ng ibang book, all gonorrhea cases should have a test of cure taken. Tingnan natin kung yun talaga ang Harrison. Okay? Ang sabi kasi, tests of cure are not generally required for urethral chlamydia or NSU cases in males. Okay? Check natin siya mamaya. Okay. A child in whom a culture is positive for Neisseria gonorrhea, gonorrhea should be examined for the presence of others. Okay. Pag nag-positive daw sa gonorrhea, dapat yung patient natin ay should be tested also for other sexually transmitted disease. Paano yung patient natin? May ginawa ba sa patient natin? Tested for other? May test bang ginawa?
Wala po.
Meron. Meron nandoon ang diagnostic test, RPR and VDRL, but awaiting result. So RPR stands for Rapid Plasma Reagent and VDRL is Venereal Disease Research Laboratory, and they are categorized as non-treponymal test. And they are tests for syphilis. Okay, non-treponymal tests are RPR and VDRL. Okay, the diagnosis of syphilis requires both non-treponymal and treponymal test result. So kapag naging reactive dito, kailangan mo mag-confirm ng treponymal test. So what are the treponymal tests? Ano yung mga treponymal test natin? Okay, tuloy na natin. Okay, ang treponymal tests are the fluorescent treponymal antibody absorption test or FTA-ABS, and we have micro heme agglutination assay for antibody to T pallidum. Okay. Okay. If ever mag-positive nga or mag-reactive yung kanyang for syphilis, ano bang treatment natin? Okay. You can just read this in your book. Basta ang binibigay natin, penicillin preparation. Ang ano nga lang, pag IV benzyl penicillin, 200,000 units, so 300,000. Pag procaine, 50,000 units international units per kilogram per day, maximum daily dose of 750. Screenshot yun na lang itong For more than 12-year-old, still penicillin pa rin. Or you can also give acute procaine penicillin. Ito din yung kanyang ito ay given for 10 days. Or, ano pa ba? Benzyl penicillin, all penicillin. Di ba paano kung allergic to penicillin, anong ibibigay mo? Okay, di ba? Penicillin. O for allergic to penicillin, anong treatment na pwede ibigay natin? We can give doxycycline, 100 milligrams every 12 hours for 14 days. Or tetracycline, 500 milligrams, Q6 hours for 14 days then. Okay. Hindi naman natin titingnan siya kung meron siyang herpes. Wala naman siyang ulcer. Pero, just in case, gusto natin siyang i-test for herpes, then ang pwedeng magawa doon is viral culture, and then yung ating PCR or polymerase chain reaction. Between the two, alin ba preferred natin? PCR or viral culture? Okay. Ang PCR is 3 to 5 times more sensitive than viral culture, replacing viral culture as a gold standard. Okay, PCR referred natin. Okay? Kung mag-positive, actually, ang diagnosis of herpes simplex is more of clinical. Kasi napaka-toxic naman ito. Pero just in case na clinically, parang sa tingin natin ito ay herpes, you can give treatment. Ano bang treatment natin? Okay. You can give acyclovir, 100 mg, 5 times a day for 5 days. For more than 2-year-old, increase lang ng dose natin to 200 mg. Also given for 5 days. Okay. Yung legal action regarding yung proof of CSA ng abuser, bahala na yung authority. Tayo, as a physician, we also need to treat the stepfather, di ba? Yung possible offender. Dapat magpapagawa din tayo. Titignan din natin yung stepfather. Pwedeng kausapin natin yung stepfather in other days. Tanungin natin siya kung meron siyang mga symptoms, yung urethral discharge, urethral discomfort or itch, dysuria, epididymoorchitis, symptoms of sexually acquired reactive arthritis, yung sabi natin na writers. Okay. Then, kahit siguro i-deny niya ito, paggawa na tayo ng gram stain, NAT test, and culture. Bahala ang yung batas talagang siya, ipagawa. Okay? Okay. So you have to take test before giving treatment to the stepfather. Okay? Bakit kailangan natin gamutin yung father o yung stepfather? Kasi untreated, persistent, or recurrent urethritis may lead to complication, epididymoorchitis, prostatitis, urethral strictures, urethral abscess or fistula, infertility, and it also facilitates transmission of HIV. Okay, ang treatment natin, okay, the same. Nung sinabi natin kanina, still ang recommended ay ceftriaxone 250 mg and azithromycin 1 gram per ORM, and they are given a single dose. May nabanggit kanina may nag-lecture kanina sa grupo ko. Sino yung nag-lecture kanina na merong regarding giving of azithromycin na it can be given for 3 days? Okay. Yung yung reference nung nag-discuss sa group ko ay meron siyang reference. Pero ang sabi ko nga, we should always follow the Nelson or Harrison or the CDC. So yung CDC at Nelson still recommend azithromycin as single dose. Okay? Ang alternative natin yung cefixime. Okay? Alternative lang siya, and it should not be used kung meron naman tayong ceftriaxone. Kasi meron na mga cases of resistant to cefixime.
Hey, Doc Alex, okay lang po.
Yeah.
Doc. Actually, Doc, yung pinopoint out kanina, Doc, yung regarding sa azit, Doc, is your chlamydial infections, Doc, not your gonococcal po, Doc.
Okay. Yung kanina atang pinopoint out niya, yung sa chlamydia lang,
Yes po.
Hindi siya yung chlamydia and gonococcal, yung parang co-infection.
Hindi po. Individual po.
As chlamydia alone. Kaya
Yes,
actually nabanggit niya rin kanina, doxycycline yung preferred over azithromycin, di ba? Yun ay for chlamydia lang. Kaya nga lang, yung Nelson Harrison natin, hindi nagkaroon na discussion nata ng isolated chlamydia and chlamydia infection. Mukhang diniscuss doon, more of co-infection with gonorrhea. Okay. So, basahin niyo yung book, tingnan niyo kung para pag binigay sa exam, alam natin yung sagot. So, ang alam ko lang, dahil sa common ang co-infection, you treat chlamydia with gonococcal infection. Di ba? Co-infection. So ito pa rin ang preferred. Okay? Okay, pag binigay sa exam, if you will answer kung anong ano nyo, ano kayo, kung how you will contest your sagot. Okay? So sa akin, advice ko, sagutin nyo na lang ito. Ang recommended is still ceftriaxone azithromycin as single dose. Hindi 3 doses of azithromycin. Okay? Yung doxycycline dito, alternative lang siya. Doxycycline 100 mg BID. Hindi siya yung ano. At binibigay siya for azithromycin allergy. Okay? Pag azithromycin allergy, you will give ceftriaxone and doxycycline. Ibig sabihin, kapag may allergy lang siya. Kung hindi, azithromycin tayo. Tama? Nakuha nyo ba? Hindi kayo na-confuse? Yes?
Yes po.
Yes po.
Yes? Yes, ha? Okay. Matatapos tayo, don't you worry. Okay. Nasa book number 4, for uncomplicated gonococcal, ito. Yung kanina okay, point out ko lang ha. Ito sa uncomplicated infection of the cervix, urethra, and rectum. Ano pagkakaiba dito? Ano ba? For uncomplicated gonococcal infection of the pharynx, ganun pa rin naman. Ceftriaxone and azithromycin. Both pa rin single dose. Hindi lang naglagay ng alternative. For gonococcal arthritis, medyo mataas na yung ceftriaxone niya, 1 gram. The same pa rin yung azithromycin. And yung ceftriaxone niya, given for 7 days. Ito pagkakaiba niya. Kung titingnan mo sa arthritis, yung ceftriaxone niya is no longer single dose, given na siya for 7 days. Huwag kalimutan, recommended, 7 days na siya. Ang alternative niya, cefotaxime. Okay. For 7 days, azithromycin, single dose. Okay, for gonococcal meningitis or endocarditis, 1 to 2. Dito ay 1. Dito naman pwedeng mabot ng 2. Pero talagang IV lang. Wala ng IM. IV lang talagang recommended. Okay. And prolong, 10 to 14 days. Dito 7 days, dito 10 to 14 days. Yung pharynx and ano natin ay single dose. Huwag kalimutan. Okay? Okay, an STI patient is not considered treated until management of their partner is ensured. So, kung yung stepfather ay meron, dapat i-treat na din natin yung mother. Okay. So ito ang importante ng notification. Notification is recommended for any partner with whom the patient has had contact within 60 days of onset of symptoms. Mamaya ipapakita ko yung kung ilan ba talagang days exactly for gonorrhea or chlamydia. Okay? Gonorrhea is transmitted from males to females more efficient than the opposite direction. Okay. Kaya pag yung males talaga, yung stepfather meron, dapat i-notify yung mga partners niya, hindi lang yung mother, baka meron pa siyang mga partners. Kasi nga, more efficient yung transmission. So advice to tell the sexual partners. So rate of transmission to a woman during single unprotected sexual encounter with infected male is 50 to 70%. So men to women. Okay, 57%. Female to male, ang baba lang. 20 to 25%. So mataas talaga ang male to female. Female to male is only 20 to 25%. Okay. Partner notification dito, so sabi ko kanina. So ito yung how far back you trace depends on what diagnosis is and when the patient develop urethral symptoms. Okay. For gonorrhea, kung merong symptoms, yes, all sexual partners in previous 2 weeks. Kung walang symptoma, 3 months. Okay. All sexual partners in the previous 3 months. For chlamydia, all sexual partners in previous 4 weeks. Kapag walang simptoma, all sexual partners in previous 6 months. 4. Ano yung NSU natin? Non-specific urethritis, 4 weeks. Ang ano natin. These figures are arbitrary. Sometimes longer period may be involved. So, pwede mo sabihin longer dyan para pasigurado tayo. Okay. So, still likely to be infectious and can still pass the infection even if symptoms go. Ibig sabihin natin, yung urethral discharge, 2 days, wala na. Pero yung simptoma niya, pwedeng wala na siya 7 days. Pero kahit wala na siyang simptoma, pwede pa rin siyang infectious. Okay. So, anong advice natin? Okay, kandaduhan. Diyos, kandaduhan, Diyos. Advice the stepfather.
Opo.
Pagkatao sino yun ako? Si Renz. Kandaduhan, Renz.
Grabe, no?
Hala. Advice the stepfather, no sexual encounters at all. Tandaan yung word na at all. No, even with a condom. Hindi pwede na may condom. Because sexual contact can occur before a condom is put on. Diba? Minsan, may mga foreplay, yun. O baka meron siya sa mouth. O yun. So, nag-condom siya. Hindi naman pwede lagyan ng condom yung mouth. Diba? Okay. Ang hirap ng Honda, hindi ko nakikita ang reaction. Pagkatapos, ang condom din daw ay can split. Pwede din mabasag yung condom. So, pag sinabing no sex, sabi ko nga, no sex, it includes genital mucous membrane contact. So, no oral sex either. Okay, So, wag mo naman sabihin kay Mrs., okay, no sexual contact. Pwedeng ito na lang. Bawal pa rin yun na. Diyos, bawal na. So, ang tanong, until when? Okay. Ang sabi sa book, until given the all clear. Diba? Ang sasabihin dyan. Okay, pag sinabi na ng doktor, okay na, sige na. Ang problema natin, marami sa mga pasyente, they will not come for follow-up. So, dapat doon pa lang sa paggamot mo, pagbigay mo ng antibiotics noon, magbibigay ka na ng advice. Anong advice mo? Sige nga, Renz. Ano Renz ang advice mo? When?
Ang alin po, Doc?
Natulog na si Renz, kumakain na siya, nabuluno ka na. Advice, there's the father, no sexual encounter, no sex at all, neither oral sex. Kailan? Hanggang kailan? Siyempre, yun ang concern ng father. Lalo na kung ang father ay ma-L. Hanggang kailan? Okay. Should avoid sex during treatment and for 7 days more following the last day of antibiotic treatment. Okay? Okay, ano ba sabi natin dito? Antibiotics that are patient, non-infectious na daw siya 1 to 2 days, pero ano pa rin? Kung to be safe, longer. Ito lang yung recommended. 7 days more following the last day of antibiotic treatment. Baka mawala lang dyan yung symptom, pwede pa rin siya maging infectious. Diba sabi natin dito? Okay, nakamali yung aking PowerPoint, yung aking animation. Test cure. Okay, ano ba tawag natin sa test cure? Ito yung follow-up testing to be sure that the infection was treated successfully. Ano bang recommendation ng test of cure? According to CDC STD Treatment and Guidelines 2015, and also according to Harrison and Nelson, i-check nyo lang ulit ito kung tama yung ating pagkakaano namin sa discussion namin kanina. Ang sabi, no need for urogenital and rectal infection. First line or alternative treatment, no test cure. Tama ba tayo sa lahat ng SUD group? Hindi na kailangan pag urogenital. and rectal. Kahit gumamit ka ng alternative treatment. But, for pharyngeal infection, kung first line treatment ang ginamit mo, no test cure. Pero, kapag alternative treatment, kailangan mo ng test cure. So, kailan gagawin? It should be performed 14 days after treatment. Iba yung sinasabi natin doon na 3 months. Yung 3 months na yun ay yung follow-up. Ha? Ito yung treatment kasi i-check mo nga kung gumaling siya. 14 days daw. Pag sa pharyngeal infection na gumamit ka ng alternative treatment. Okay? Okay. However, if a person continue to have parang i-continue to have symptoms and parang meron pa rin siyang infection even after receiving treatment, then doon ka gagawa ng test cure. So ito yung is only done. Okay? Or, pag sa tingin mo talaga hindi naman talaga siya naggamot, ay pabalikin mo talaga siya for test cure. Okay? Pag meron siyang poor compliance or re-exposure to untreated partner, ano bang gamot natin? Nagkaroon ulit siya ng STI, gonorrhea, because of poor compliance. Nung tinanong natin, di pala nag-take talaga, lalo pag binigay natin yung alternative treatment or nagkaroon ng re-exposure. Same treatment. Okay. If good compliance and no re-exposure or suspected treatment failure, anong gagawin natin? Nagamot naman siya. Wala naman siyang history of sex. Magpapagawa ka ng culture with or without simultaneous NAT, might be caused by other organisms, siguro pag negative, or you can do antimicrobial susceptibility testing. Okay, kasi di ba yung treatment natin, for example, yung trichomoniasis, ang treatment natin doon, metronidazole, tama, di ba? Metronidazole yung treatment natin doon. Pag trichomonas. Okay? Follow-up of stepfather. Okay? So sabihan mo yung father should return 3 months for repeat testing to rule out the infection. Kasi nga, mataas ang chance na baka naman nagkaroon siya ng reinfection. Okay, ito. Some studies have shown rates of co-infection is inadequately treated patients to be as high as 20% at 3 months. Okay. Reinfection from untreated sex partner or sex with new infected partner. Okay. Okay, ito, ano na lahat natin. Facilitates acquisition of SIV, sharing of SIV. Okay, para shorted natin yung ating discussion. Ito lang, anin ko lang ito. Okay, alam na natin ito, di ba? Na-discuss na natin ito. Magpapatest din tayo ng SIV doon sa stepfather. Tingnan natin kung sa bata kailangan natin. Kung sa stepfather, lalo na may MSM tayong duda, magpapatest tayo ng enzyme immunoassay. So, pag positive screen, dapat maging 2 reactive screen out of 3, kino-consider natin siyang positive. Okay? Then, ang confirmatory test talaga, Western blot test, indirect recent antibody assay. Okay, matatapos na kita. Okay, last slides. Ito na lang. Sex is like driving a car. One wrong move can cause accident. Be responsible and know how to be safe in the road. In the same way as you should practice safe sex. Okay? For that, thank you. Okay, group picture tayo sa ating ano. Nandiyan pa ba kayo?
Yes po.
Tayo sa attendance natin. Sino bang tumagal? Ilan ba kayo? Oh, thank you. Okay, go picture tayo. Kaya lang talagang hindi gumagana ang aking... Bakit hindi gumagana ang aking... Okay, bas ako yung area. Pasenda lang sa akin gano'n ng ano. Hindi. Naka-share screen pa ako. Stop share. Okay. Okay na ba? O baka gumana na yung video ko. Yun. Gumana. Gumana pala siya kapag hindi nag-share. Okay. Nandito si Benjo. Sorry, Benjo. Hindi kita natawag.
Sumasagot man po ako.
Wait ka kasing dumating. Okay. This is okay. This is my last case synthesis with you. Thank you, year level 2. Good luck. Third year na kayo. Okay. Bye-bye. Hindi ko na ma-handle sa
Thank
SPL.
you po, Doc.
Thank you, Doc.
Thank you po. Bye-bye po.
Thank you, Doc.
Thank you very much. Okay, bye-bye. Okay, bye.